everyone. My name is Lynn Labarda, and I'm the founder of iMark Billing. Thank you so much for joining us on today's webinar. And we're going to talk specifically about the billing changes that are going to affect the Medicare certified agencies that come into play January 1st, 2022. So we are going to talk to you exactly about what you need to know to be successful in billing the NOAs, which are the Notice of Admissions. So thank you again for joining us, and let's get into it.
All right, so let's get started on the webinar on how to get the NOA requirements right. And again, this webinar is for Medicare certified agencies. So let's talk a little bit about our objectives. So today we're going to learn the requirements and details on filing the NOA, which is the Notice of Election. And we're also going to go over what the differences are between the NOA and the RAP. And that's really important because right now, currently, we are billing a RAP. It's a no-pay RAP where they don't pay you for that RAP. And the RAP will be replaced with the NOA, and that is effective January 1, 2022. So I'm going to give you all of the details that you need to know on how to get this right. We're also going to talk about the penalties for late filing of the NOA. It's slightly different than the penalties that we have now with the RAP, so we'll go over those details. And of course, I'm going to give you clear action steps on what you need to do to be successful come January 1, 2022. Okay, so let's get into the differences and the similarities of the no-pay RAP, which is what we're currently using, versus the NOA, the Notice of Admission. So currently, agencies are billing RAPs. We're billing these RAPs every 30 days. So for every 30-day payment period, we're billing a RAP. That RAP has a type of bill 322. Okay, so that is generated in your software, the type of bill 322, and it goes on the claim. But that is currently what we're doing. We're billing a RAP every 30 days and we're not getting paid. So what's changing? So effective January 1, 2022, the RAP is going to be replaced with the Notice of Admission. So we're not going to be billing RAPs anymore. Instead, we're going to be billing a Notice of Admission. So the NOA's type of bill, so we talked about the fact that the RAP has a 322 type of bill. The NOA's type of bill is changing, and it's going to be a 32A. You don't need to worry so much about this because this is automatically populated by the software, but still it's important for you to know that the NOA has a 32A bill. And will be required for periods beginning on and after January 1, 2022. And we'll get into a little bit more of that transition moving forward. So the similarities, let's talk a little bit about the similarities with the no-pay RAP process that we're currently doing now. So first off, the NOA also has to be submitted within 5 calendar days. So that is still required, just like what we're doing right now. So that's really not going to change much. The penalties, where you will be responsible for any days that the NOA is late, that also stays the same. So if you submit that NOA after the 5 calendar days, you're going to be liable for all of the days until that NOA is accepted. Now, there is a difference there as far as what that penalty looks like, and we'll talk about that moving forward. But the penalties, the concept of the penalties is still the same. The exception or the difference between the NOA versus the no-pay RAP is that you're going to be billing the NOA only one time upon admission. So that's one of the biggest differences. The RAPs right now, we're billing them every 30 days for every 30-day period. And the NOA is only billed one time at the beginning upon start of care. So, the purpose of the NOA is to let Medicare know that the patient has entered into a home health period. That's the purpose of the NOA. So we will not need to submit an NOA every 30 days. So It's only one time upon start of care. So very important point. We will not submit an NOA every 30 days like we do the RAP. It's just one time. All right. So the NOA, what that does is it establishes a admission period. And the admission period is a new language from Medicare. We haven't used the word admission period before. But the submission of that NOA establishes that admission period. And the admission period, according to CMS's definition, starts at the from date of the claim and goes on through the discharge date. So that is considered the admission period, from the from date through the discharge date. So of course, between the start and the discharge, there will be 30-day periods in the middle, okay? And remember that we're not paid for the NOA. So we still have to bill those finals every 30 days, okay? So we still have 30-day periods from the from date through the discharge date. Just understand that the new language is now called an admission period. And billing that NOA establishes that admission period for the patient. Only one NOA is required for any series of HHA periods of care, beginning with the admission to home care and ending with the discharge. So again, like we said, one-time NOAs. Now, if a patient, though, is discharged and then readmitted to the agency, a new NOA is required. So that makes sense, right? If you discharge the patient from your agency and you're going to readmit that patient, of course you need to do a new NOA, and it is required to be billed within 5 calendar days of that new start of care. And don't forget that the final claims for every 30-day period are still required. So we still have to bill those final claims, because remember, that's where you get paid. So it's very important that you don't forget that the final claim process is still the same, and that's where you're going to receive your payment, because in the NOA you're not going to be receiving a payment. All right. So again, it's a one-time submission upon start of care. So, I would say on a positive note, this is going to lessen the burden on the staff in having to submit RAPs every 30 days. So, that's the good part about all of this. It's less transactions that need to be filed. So it'll just be one notice of admission submitted upon start of care. So that's a good thing from an administrative point of view. The NOA can be keyed directly into DDE, into the Medicare system, or it can be billed through the software. We as billers do both. We sometimes key them in or we submit them through the software. It just usually depends on the time frame of that NOA. So, the goal here, and we're going to talk a little bit more about that, is to try to get that NOA out, just like we're doing with the current RAPs, the current no-pay RAPs. We want to try to get them out within 24 to 48 hours. That way they can be billed through the software, they can get to the Medicare system, and they can be accepted. We need to watch them and make sure that they don't get RTP'd or rejected. They need to be accepted within 5 calendar days of that admission date. That is the same process as we're doing right now with the RAP. So, if we see that the NOA is getting close to that 5 calendar day period, then usually we'll end up keying the claim directly into DD. So just know that you have both of those options, and know that the process of sending that NOA, when you submit that NOA, it has to be accepted in order for it to be within those 5 calendar days. So we as billers are constantly looking at the Medicare system and the DDE system to make sure that NOA was accepted. And if there's any issues where it gets rejected or RTP'd, we have to get that fixed as soon as possible. All right. So I really like this slide because it just shows you a visual representation of the NOA and the claim submissions. So in this chart, you can see that this is a 60-day certification period. So this entire thing is a 60-day certification period. Here at the beginning is your start of care. So in red, we're marking that that NOA must be submitted within 5 calendar days. Again, this shouldn't be such a big difference from what you're doing right now because you are currently submitting the no pay wrap within 5 calendar days. So it's going to be pretty much the same thing. We recommend that that NOA gets submitted within 24 to 48 hours. That way we allow time for it to process in the Medicare system. So here in the red is when you're going to be submitting that NOA. So now in the middle, you reach the 30-day period. So what do you do upon 30-day period? You're going to bill your first final. So that has not changed. It's the same process. And then let's say you continue to see the patient and then you've got the second 30-day mark. At that point, you're going to bill the second final if that patient is discharged. Or if the patient is discharged before the 30 days, you'll be able to bill that second final. So when it comes to final claims, the process is the same. Process is going to be the same. So as you can see, the difference here is that the NOA is only submitted one time at the beginning of start of care. Notice you're not billing another NOA or anything like that upon the first 30-day period. You're not at the end of the first 30-day period. You're not doing that. It's only at the beginning. All right. So what are the requirements to submit an NOA? They're basically the same as what we're currently doing now. Okay, so that's very important. The HHA can submit an NOA to Medicare when the HHA has obtained a verbal or written order from the physician that contains the services required for the initial visit, and the HHA has conducted an initial visit at start of care. So that has not changed. It's the same process that you're doing right now. So it's just the order and the start of care visit done. You don't have to wait to complete the OASIS or the plan of care to submit that NOA. So this is a very important point, and a point that I feel that agencies still get a little confused even with the no pay wrap rule. You do not have to wait for your OASIS to be completed or transmitted or the POC or the plan of care done. You do not have to wait. We should be billing that NOA within 24 to 48 hours. We do not want any delays in submitting the NOA. So if the patient can be set to admit and the schedule has the start of care visit completed with a primary diagnosis entered into the software, then the NOA can be submitted at that time. So the goal is 24 to 48 hours max. All right, so let's talk a little bit about the penalties. We all know that there are penalties currently if we do not get those wraps in on time, right? So we have a current penalty for the wraps right now. The difference with the NOA here is that, the no pay wrap rule, the no pay wrap is that you will not be paid for any days until the NOA is accepted. So the NOA penalty would essentially it's from the days from the start of care to the time the NOA is actually accepted. So if you, let's say, do not bill the NOA for 2 months, for example, you will not be paid for all of the 2 months. So the NOA is very different. At least the amount of penalty that you could receive is different, because when it comes to the no pay wrap, the current no pay wrap rule resets every 30 days. So you end up possibly having less of a penalty. But when it comes to the NOA, they will not pay you for any days that NOA is not submitted. So like I said before, if it takes 3 months, if you forget to send the NOA altogether, let's say, and you end up just billing those final claims and the patient is discharged, but let's say you forgot completely to bill an NOA, you won't be paid at all for that, for those 30-day periods. So very, very important that NOA gets submitted within the 5 calendar days, or else the penalties could be quite large. So let's talk about some of the NOA penalty exceptions. So these are exactly the same exceptions that we have now with the no pay wraps. So when it comes to the exception is Medicare will grant and will allow some claims to be eligible for for the penalties to be removed for 4 basic exceptions. Okay, and this is exactly the same as what we're seeing currently. If there's fire, flood, earthquake, or any other unusual event that the home health has experienced that does not allow them to get the NOA out on time, that is an exemption that can be filed. An event that produces a data filing problem due to any issues on the CMS side. So this is not a computer problem on your side, on the agency side. This is a data filing problem at CMS. If that occurs, then Medicare will grant us an exception. The third is a newly Medicare certified agency is also exempt from the penalties for the NOA. So this one's going to be important for any startups that might be on the call, because Medicare does grant us an exception for filing those NOAs late, because newly certified agencies will be able to bill after accreditation, but will not be able to send those NOAs until they actually have access to the Medicare system. So that is an exemption. You will not be penalized for submitting the NOAs late. And then, of course, the last part is general statement of other circumstances that Medicare deems is valid for an exemption. So obviously, we would do this as a billing service. We would file the exemptions, and we would submit all the necessary paperwork in order to hopefully for the MAC to grant an exception for any late NOAs. All right, so let's talk about the transition and the implementation of the NOA. This, of course, we are referring to any kind of crossover patients that start their care in 2021 and continue through 2022. So any of those episodes that bridge 2021 and 2022. So this is the guidance that was provided to us by CMS. The HHAs shall submit an NOA with a one-time artificial admission date, which corresponds to the from dates of the first period in 2022. Okay, so I know that may sound a little strange, but I wanted to give you an example, and in the next slide, I'm going to give you a visual version of it as well. So, for example, let's just say that if the start of care is on 12/13/21, the first 30-day period of care runs from 12/13/21 until 1/11/22. Okay, so this is an example of the first 30-day period that runs from 12/13/21 through 1/11/22. So what do we need to do? We're going to need to bill a NOA on 1/12/22. On 1/12/22 for the new period that starts in January of 2022. Okay, so here's a nice version, visual version of this. So let's say that let's say we have a start of care of December 13/21. So what's going to be the 30-day period if 12/13/21 is a start of care? So the 30-day period is from 12/13/21 through 1/11/22. So what Medicare wants us to do is submit an NOA with an admission date of 1/12/22 for that next 30-day period. Okay, so of course, collaborating with the software is going to be important during this time, because we're going to be able to bill that NOA through the software, and they'll have all the updates that we need in order to get that claim out in January with the artificial date. All right. So the transition of the NOA in January is going to be very important. It's going to be important to educate the billing team on the NOA and the specifics of that transition guidance. Just be prepared for increased work in January, because obviously we're going to have to make sure that we've identified all those crossover claims and that we are billing those NOAs with those artificial admission dates within 5 calendar days. So we do have to do that within 5 calendar days. So that's going to be quite a bit more work in January, but once we get all those claims out with those artificial dates in January, everything is just going to fall into its normal pace after. Another thing I want to warn is be prepared for errors. Be prepared for Medicare and the MACs to have implementation issues during the first quarter. We all know that this happened during the implementation of the no pay wrap rule in January 1, 2021. We had cash flow slowdowns. We had final claims that weren't paid correctly. We had wraps that were getting penalized even though they were submitted on time. Unfortunately, be prepared for that. We suspect that the same thing is going to happen. We're hoping, since the process is so similar of the NOA, we're hoping it's not going to be as terrible as it was in January 1st of 2021, but just be prepared for slowdown of cash flow and issues when it comes to final payments being paid. We expect that. And again, I think the most important point to drive home here is be very mindful of that 5 calendar day submission window for the NOAs. Those NOAs need to be submitted within those 5 calendar days so you can avoid any penalties. And again, I just want to remind everyone that you do not have to wait to complete your OASIS or plan of care. You do not have to wait to complete that OASIS or plan of care to submit the NOA. So this is very, very important. This seems to be a topic of confusion for agencies. You don't have to wait. You can submit that NOA as long as the patient's set to admit, you have an order, you've completed the start of care visit, it's in the calendar of your software, the primary diagnosis is dropped in to the software, then you're able to bill that NOA. So we should be billing that NOA within 24 to 48 hours. So hopefully this clears up the NOA transition. Like I said, it's not very, very different from what we're currently doing. It's just a replacement of the wraps. There's no more wraps, and now they're called NOAs, and there's only a one-time submission. So I hope this has been very helpful. If you have any questions, here is my information. Shoot me an email, and I would be more than happy to go over any questions that you have on this transition. Thank you so much. Thanks for watching. Appreciate it.